Dobrý den, milí přátelé. Dnes bychom se s vámi chtěli podělit o záznam z našeho Zoom callu, ve kterém se dozvíte mnoho užitečných detailů spojených s onemocněním PANS a PANDAS. Sára Valentini ve videu popisuje některé svoje případy dětských pacientů se symptomy PANS a PANDAS. Zmiňuje průběh jejich onemocnění, reakce na podané homeopatické léky, ale dozvíme se také o tom, jak vlastně vypadá život v rodině s takovým pacientem. Dozvíme se více o akutním vzplanutí neboli flare a o tom, co jej může způsobit. Uslyšíme, jak mnohostranným a účinným nástrojem je citlivý a individuální homeopatický přístup ve srovnání s jinými metodami. Toto vše je ale jenom malinkatá ochutnávka velkého online webináře se Sárou Valentini, na který se můžete těšit v říjnu letošního roku. Veškeré informace o přesném termínu a možnosti přihlášení se včas dozvíte.
Hello everyone, good morning or good afternoon everyone. It's a great pleasure for me to welcome here my beloved friend from Australia, Sarah Valentini. Good evening to you, Sarah.
Good evening, good morning.
Yes, it is still morning in the Czech Republic. Just a brief introduction how we met. I had a pleasure to meet Sarah on Michal Jakir's trituration seminar last year in Tenerife. It was a wonderful time with a wonderful group of worldwide spread homeopaths. We were triturating various new remedies, a great meeting, and many nice friendships were started there, and they are still lasting. But this is not the purpose of our meeting today. I invited Sarah and kindly asked her if she would be so kind and could share her knowledge of the PANS PANDAS phenomenon with us. This is something that is not very well known in our region, although we are familiar with the symptoms, but we don't know this very much in depth. So I am welcoming her and I would like to ask her, Sarah, if you would like to share any aspects of this with us, please.
Yes, thank you, Jana. So I wanted to talk about a case first of all, that a case that I had about 10 years ago, and that this child presented with me, and he had major fears. He was about 9 or 10 from memory. It was a while ago, but he had major fears, and he wasn't able to sleep suddenly wasn't able to sleep in his own room at night anymore. He was really struggling to go to school. He was really going inward. He's looking very pale. And he wasn't talking much to me, but his mum would tell me, and this is a really common thing because they do find it really hard to talk about the difficult symptoms, that he was really withdrawing and that the fears were just getting worse and worse and worse. And so I took the case and I prescribed the indicated remedies, and he got a little bit better, but not really. Like, we saw these little improvements, and then it would all go backwards. For a moment I thought he got out of his parents' room, because he started sleeping in his parents' room, back to his room, and then back again into his parents' room. And in the end, they just surrendered to that, and he just stayed sleeping in his parents' room. And they went camping, and he wouldn't leave the tent. He stayed inside the tent the whole time. And so it was really affecting this kid's life, and it was incredibly frustrating. And I often think back to that case and think, if I had have known then what I know now about these infections and how we can help them with homeopathy, I feel like I could have helped that kid. So this is something that really stayed with me and really drove me. The other thing was that my oldest son had symptoms that were similar but different, like this. And so he was the same. I was taking him to another homeopath and indicated remedies, and I took him to a few very good homeopaths, and the indicated remedies would do a little bit, but then he would revert. And so I really became fascinated, and I knew homeopathy would have the answers. to help him and to help our family, but it just couldn't quite access it. And then I was working with a naturopath who had started talking to me about PANS. And I was really interested that, actually she was talking about PANDAS at the time. I was very much interested that when there's a strep infection, that these children present with neuropsychiatric symptoms. I mean, that was completely fascinating. I mean, what's going on with the vital force when that happens? It goes straight to the level of the emotional, the mind, the mental and emotional sphere. And, we could argue as well the spiritual sphere. We also see these inherited patterns. I can often see in the family history that there's been a history of either autoimmunity or a lot of toxicity, a lot of syphilitic energy and syphilitic miasmatic energy in the history and that kind of thing. And so, so I started to study and look and research, and I started working with my business partner and colleague, Angelika Lemke in the US. And I just understood more and more and more what we could do to help them with homeopathy, which is quite profound, actually, what we can do. So, from there, I've just gone on more and more to create the homeopathy hive in the US and my clinic here in Australia, where mainly I'm seeing complex children. And I have, there's 8 other practitioners working with me that are working with these complex children as well.
Wow, that sounds really fascinating. And actually, you are mentioning those little pieces that are also present here in Central Europe, like Angelika Lemke's book, Complex Children. When I heard about it, which is over a year ago, I said, wow, what an interesting title of the book, like Complex Children, what's complex about them? And only now do I know, after meeting you on Tenerife and then reflecting back on the thing of PANS and PANDAS. And as you say, and as I confirmed with a few of my colleagues, we all had children or teenagers with similar symptoms, but we had no idea that we should have been digging into the streptococcus, presence in the cases and stuff. So we all just have some pieces of the puzzle, but what I would like us all to know after our webinar is to have a few more, or a complete puzzle, the complete picture, actually. Because yes, it's worth knowing. I believe that this condition is, among children. It's nothing really rare, I would say.
Yes, that's right. Well, statistically in the US, they have the PANDAS network, and their stats are 1 in 200 children have PANS or PANDAS, and they think that is a grossly underestimated statistic. So, that's up there with ALS, I know, and a few other, I think it's juvenile diabetes and these kind of things. Like it's quite significant. And if we think now in terms of autistic children, which has been creeping up more and more and more, and I have to say there is a lot of crossover with autism and PANS and PANDAS, also with ADHD and these kinds of diagnoses. There is a picture, and all of these kids we can look at as from a neuroinflammatory approach. So and so, we need to kind of work with it like that. These kids are highly inflamed. They've got layers and layers of infections often. And some people have asked me, or, have said, have assumed that it's only the vaccinated children that may get PANS and PANDAS, but actually it's not. And which is interesting, because even though that is definitely a factor that contributes to a leaky blood-brain barrier, it is not. We're having kids born into an immune system that is not robust, enough. Then you throw in electromagnetic frequencies from Wi-Fi and all of these things that weaken the blood-brain barrier, and we've got like a really kind of direct pathway for antibodies that are developed against these pathogens to cross and hit the receptors in the brain and cause these neuroinflammatory symptoms. So it's
Wow. So it's a whole network, a whole bunch of things pretty much interconnected. So yeah, it
yeah,
sounds like something really, something worth
yes.
knowing, definitely.
It is. And also it's even if the child doesn't have a diagnosis of PANS or maybe doesn't have like a really obvious PANS or PANDAS case, it's actually really helpful to still understand how these pathogens affect us. So whether it's a virus or a bacteria, whether you're affected by mold, yeast, the Lyme infections, such as Borrelia and things like that. These are all like the layers. And recently I spoke at a conference about working through layers because some of the kids, it's not just you just give them streptococcinum and it's done. Like it's not like that. And sometimes you are cycling through a number of infections as well as supporting the constitutional state along the journey. So it's quite a lot of weaving. But I think once you understand, what can happen and what can present in these cases, you could think about the treating. So at this conference, I presented a case of a child that I was seeing that came to me. I'll tell you a bit about this case because this was at the time one of the worst cases that I'd seen. And I don't always get families that come to me with a child that's in the middle of the flare. So a flare is when they've been exposed and suddenly those neuropsychiatric symptoms just ramp right up. So just the neuropsychiatric symptoms can be severe anxiety, separation anxiety, like they will not be able to separate from their mother or their father. Like they will not. And they will do anything for that staying near mum. Like they're desperate, they're begging. They can also be rageful, they can self-harm, and they can develop tics and strong OCD, like the OCD in that I'm not going to be able to get through this day. I'm going to die if I don't do this, which is kind of something that actually tries to keep them safe because in a way they're living their worst nightmare. If you think about stramonium, it's like living in a nightmare. That's what they're living. Stramonium is just not the only remedy that they need. I mean, we can think about manzanella as well. There's a number of really good remedies. So these kids are kind of this uncompensated state. But so this girl came to see me. She was, I think, 14 years old, and she was in one of the worst flares. She'd been in this flare for months. And so mainly I see these families online because you cannot get that child to a clinic. Or if you do, it's not going to be a productive case-taking session because you'll be dealing with the anxiety. The parent will be dealing with the anxiety. So I met with this family online and there was a lot of kerfuffle. I spoke to the dad first, but the mum was there and she was tending to the daughter. Eventually the daughter came onto the screen and she was sitting there, her eyes were rolling back into her head. She just wasn't there. Like she was trying to be there, but she couldn't be. She was pale, she was puffy, she was like so completely out of it. I don't know if that's an Australian expression, but she just wasn't there. And then she started getting really anxious and flapping, and so her mum kind of took her off to calm her down. During this flare, she'd run out onto the road. She'd been threatening to jump out of the upstairs window, screaming, raging, all sorts of things, hurting herself, and extreme nausea, vertigo. She would also sometimes pass out. So she would just be sitting there in that state, and then she'd just collapse and then come back. She was so unwell. And so I took the case, and for her, I gave her streptococcinum, and we started with 30C. And so immediately, and at this time as well, because they can be very, very suspicious, you can't give them a remedy directly. So the mother had to sneak it into her water.
Oh, okay.
Yeah, because they can be very suspicious,
Mhm.
and feel like they're going to be poisoned. Also, this girl, one of her major symptoms is that's one that has kind of lasted throughout the case. I've been seeing her for 18 months, is an intense fear of vomiting. And this is common as well. It's quite a common symptom. So fear of choking, fear of vomiting is a big one. So anyway, I gave her the streptococcinum and she started to, things just got a bit better and a bit better and a bit better. And I went up in the potencies, and I gave some other supportive remedies as well over the time. Lachesis, I think, was helpful, and I can't remember them all from the top of my head, but streptococcinum was the main remedy for this girl coming out. And she was doing incredibly well, and she'd started to be able to go, because of course she wasn't going to school anymore. Like that's, I mean, these people are surviving day by day. School is just like that, can't, most of the time can't happen. So these kids end up being homeschooled, but really they're not being homeschooled because the inflammation is so great. They can't remember what they've done. They can't focus or concentrate. When this girl that I'm talking about, this patient was in a flare, she couldn't even look at she couldn't watch TV. She couldn't look at a screen. So 24/7, unless she was actually asleep, her mum was there trying to keep her safe. Really intense. Anyway, so she was doing brilliantly. She'd managed to go to Pilates. She'd started this little kind of business that she was doing as her homeschool project, making hair things, and she was going out a little bit more. And she wasn't that girl, that same girl. And then in February of last year, she started going into a flare again. So I was like, okay, let's try the streptococcinum again. But it did nothing. So we were weaving through. And then what I noticed after taking the case, I'd given it, she had Dupuytren's contractures. She was getting a few different unusual symptoms. She was getting urinary symptoms, which are also common with PANS and PANDAS, where they feel that they need to go, or they feel like there's a drop of urine on their underwear and they just can't stand it. So there was a few things happening, and we kind of moved a few things, but her fear of vomiting and choking was going up and up and up and through the roof. So I took the case again, and then I realized that she was really stuck in a loop. So every night around the same time, she would start to be worried. I'm going to vomit. Are you sure I'm not going to be sick? And actually, when we were in Tenerife, she was texting me, because that was when she was actually just before we went to Tenerife. I'd given a remedy. I gave her a different nosode, because what I realized was she was in a viral state. So viruses can also cause this neuroinflammation, not just the bacterias. So I'd given her Coxsackie, which is the hand, foot and mouth virus. I gave it to her as a cord, which I realized later on when I went back through her notes that actually the Coxsackie virus was one of the illnesses she had just before she went into her first PANS flare. So with giving her that remedy, it completely softened again. And so yeah, it was such a relief. It was remarkable. But you can see we went from a bacterial infection, and that was no longer the issue, but the viral infection was affecting her. So I needed to hit that. And so the viruses and the bacteria, they have different indications as a group, which I can tell you about. We can go into how you recognize a virus or bacteria. We can also look at yeast is also a big issue often yeast and strep sit together. And so sometimes you have to deal with strep, but then you'll have to deal with yeast. And I do that with a few different remedies. And then we have parasites as well, which can be an ongoing issue, because these kids' barriers and borders are open, they're leaky. And so parasites and parasitic entities, they can enter. Dark spirits almost are coming into play, because that's what it's like. These kids are really, it's like going into a psychiatric ward. And actually, I shared this statistic at the last conference I spoke at, that there was a research paper done on a mental institution, a psychiatric institution in the US, and they tested all the psychiatric inpatients for Bartonella. Bartonella, which is a co-infection of Borrelia. Maybe you all know Bartonella there. And 70 to 80% of the inpatients had Bartonella. So, Bartonella is a huge remedy, which it's a bacteria, but it has parasitic kind of feel to it, because it sits on the Lyme tick. So just navigating through all of these things, right? It can really help. But, even if we have a child that comes with a bit of anxiety, and if their anxiety ramps up when they've got a sniffle, or if their obstinance ramps up when they've got a sniffle, you can also look to these nosodes. I mean, even influenzainum can be really great for these kids. Herpes viruses are often sitting there underneath as well. So yeah, there's kind of as mentioned, a lot of weaving and moving through. But the whole Lyme disease state as well, which is very syphilitic, has that kind of parasitic entity state to it as well. Like I mentioned with the Bartonella, it's like it's
Wow,
like possession.
it sounds magical. Like, thank you so much. Well, mentioning Borrelia and Lyme disease, this is such a big thing here in Europe. It's the tick-borne stuff. You can have either encephalitis or this borreliosis, and actually, it's so hard to cure. People don't get better, or it takes so long for them to get better, and nobody actually knows whether it still resides within your neurological system or not. So it's quite a challenge.
Yeah.
Anyway, the feeling that I'm getting from your description, is these connections between what you see with the patient, which we see with our patients, but we don't have the special glasses of knowing, this can be this can be linked to that. So this is what I'm really looking forward to learning from you, because this is what we are not familiar with.
Yes.
Yeah, we might get similar cases, but what we see is like we work differently, and I believe that this knowledge is really missing here. So yeah.
It's incredibly helpful in my practice. It's kind of illuminated a lot of dark corners where I didn't really know how to access. And just on that, like, we don't always need to use these nosodes to clear Lyme, or we can still be using the indicated thesimilimum, right? Like it's still incredibly supportive and important to be working with the thesimilimum all the time, in my experience. But we're kind of having to move through the layers of infection, almost like with intercurrent, or sometimes I'll do a protocol of clearing an infection. It really just depends always on the client. But it is a multifaceted approach. It's not just a one remedy once, and it's not just a similimum. There is another clinic in the USA that treats PANS and PANDAS very classical homeopathy, and they will give the child one remedy once a week. And to me, I just can't do it, because these parents come in crisis. So, and if one of these children flares that is in the care of this clinic, they will say, take antibiotics, get through the flare, and then we come back to constitutional treatment, which we have so many amazing tools in homeopathy, so many. And, when I have children that get better like this, and you can just see their immune system. I mean, I don't want to give them, if it's an emergency, sure, take the antibiotics. If there's a really high crisis and we can't seem to move through it, absolutely. But it shouldn't be, go back to the antibiotics all the time, because you're kind of doing this, you're messing with the immune system.
Counterproductive.
Exactly. And what we're trying to do is fill up those holes that are in that immune system, which we can do with homeopathy. Yeah.
The way that you describe it sounds a little like Ton Janssen's detox system, where you also, go through the layers of stuff that appear in the case. But I think that this sounds to me like there are many more options here in the system that you describe. You always have to look a little more to the right and to the left and take into consideration many more aspects, as long as I understand the way you explain it.
Yes, yes. And Ton Janssen's approach is very like it's I guess it's, he brings in a lot of which I love the way he does that, but it's very much more a system, whereas we have very much an intuitive, individualized approach. And it's not, some of these kids as well, when they come and their immune system is so dysfunctional, a lot of them will have a lot of allergies and mast cell activation syndrome, which we see a lot of. And so if you start to detox a child with mast cell, or if you start to shift their gut microbiome too much, you're going to see them flare. And so you end up like so many kids have come to me, or families have brought their child because they've seen either a functional medicine practitioner or even a homeopath who's gone in to do these detoxes, which would be appropriate if the child didn't have the mast cell activation syndrome, which just throws out all the inflammatory cytokines and the histamines, and then they're in the brain on fire state again. And so you have to kind of work with that where it's relevant. And understanding that layer, work with those mast cells, calm all of that down, and then bring in the detoxes or the nosodes or whatever. I mean, sometimes though the nosode, I have seen the nosode be the simillimum as well. Like streptococcinum can be the simillimum too. Yeah.
Yes, that's exactly as you said. To me, the Ton Janssen things, it's more like a linear thing. You ride on a highway, but you don't look to the left, to the right. Whereas, as you said, that was the word that I wanted to mention. You have to work with your intuition or use it really, what's appropriate, So it sounds much more like alchemy of, really observing very attentively, listening and looking. So yes, I am all thrilled to learn a lot more about it. Wow.
Yes. Yeah, it is. And also working with the ancestral piece with these families too, because often there is a heavy kind of ancestral layer. Or that heavy syphilitic layer in many cases. And, really kind of understanding that, it's so common that I'll see that the mother had an autoimmune thyroid condition, or the grandmother had scarlet fever or rheumatic fever, or, where it's existed back then. And perhaps they kind of got through it and then they had their own child. I mean, really, streptococcinum, it's like it's its own miasm, really. And when you hear Andreas Tilch talk about streptococcinum, you can kind of see how, okay, like this was here before, and really these kids show us the most uncompensated state of streptococcinum. They show us, like the darkest stramonium, or, the darkest manzanella. There's a spectrum of every remedy, right? We can have the cycles and the segments of every remedy. These kids are showing us the most uncompensated state of these nosodes, absolutely, or these infections, absolutely.
Okay. Wow, that sounds really magical. So thank you very much for sharing this introductory teaser with us, because yes, we are all very much looking forward to learning more about it. And yes, so
yes,
that's pretty much it for now. So I'll be looking forward to having you explain us all the stuff about it. And yeah.
Yeah, And I'll be looking forward to, because you know I used to live in Prague, and I'm very much looking forward to connecting with the Czech homeopaths.
Okay, that's great.
Yeah.
Lovely.
Thanks, Jana.